Basically, what I want to see is what are the key aspects we should consider for building a resilient healthcare system in this, particularly in this region. There are many challenges. I think we have to keep some key factors which are important. The main thing is geographical barriers. Everything is isolated. Populations are scattered. We have very limited resources. Of course, this region is very prone to natural disasters. We have to keep that in mind. Climate change is a big issue. I think we are all aware of it, whether we agree with it or not, but the fact is that we are facing climate change and the rapid melting down of the glaciers, it's causing flooding and everything else. So I think we have to be aware of that, and also it impacts health. The other thing which is in this Himalayan belt, we have cultural diversity. If you go from the east to right up to Ladakh, there's difference in cultural diversity. So how do we promote resilience? We have to take, I think all the speakers mentioned about community-based approaches. I think we have to focus on that. Telemedicine, I think Tarak Ramji mentioned about telemedicine and e-health. Disaster preparedness, I think Government of India has done phenomenal work with NDRF and SDRFs. I think they are doing wonderful work. I think, again, we have to work with them closely. I think you are doing wonderful work on that one. Mobile health units, I think both the groups are doing wonderful work in that. I think traditionally in India, particularly, or even global south, we have the ambulances. The concept is just to take a patient from point A to point B. But I think that concept is changing now. I think the concept now is to stabilize a patient. But I think we have to culturally also be aware that ambulance is not meant to take a patient from point A to point B. It's not a mode of transportation. It is to save a life. Unfortunately, my experience has been that the family or the caretakers, they want immediately to rush him to the hospital or her to the hospital. So I think that is changing also. I think now we have more sophisticated or life-saving ambulances services. So I think that is changing also. Next. Integrated health programs, I think Tarak Ramji mentioned about that. I think we have to have training and capacity building. I think cross-training, which I keep on training, that we have to train ourselves. I think CPR training, I think should be made mandatory in all schools. I think all school children, I think you mentioned about school programs, we should train our school students. Like we do the NCC, we should provide CPR training to our students because many lives will be saved. Of course, mental health support, I think we are all going through this. I think as the demographic is changing, I think we are living longer. I think mental health is also, the societal pressures are, and research and data collection, only then we can provide solutions. Next. The benefits of, we'll have improved health outcomes. The communities will empower. I think what I heard today is that we have to go not top down, but bottom up. We have to have a buy-in from the communities. Unless we empower the communities, we understand their needs and we can adapt to that. Rather than tell them that this is how you should do it, it does not work. I think we have to go bottom up. Sustainable practices, again, we have to have sustainable. COVID has shown us that we have to have sustainable practices which will help us, whether we use traditional medicine, herbal medicine, whatever it is, we have to have. One thing which I noticed, I was traveling recently in Uttarakhand area, Dodital, that area. Even the remotest corner of Uttarakhand, you can find McDonald's, Kurkura or whatever that is, in the remotest corner. So there is that market penetration by these corporate entities, but unfortunately health is not there. So we have to sort of learn something from the corporate marketing tools to how we can reach, because health is important. But if they can sell Pepsi or Coke in the remotest corner of Uttarakhand, we should be able to do it. We should be able to learn them. Yes, I think I did mention about cultural competence. I think we have to have respect for the local customs and languages and build a trust. I think we were having a conversation in the previous session. I think how we can build the trust with the communities. I think we have to, I think somebody mentioned that some of the leadership people, they had their deliveries done at the local health center where midwives are involved. I think that those kind of things will help us in building a trust with the local communities. And we should be able to build a resilient health system by being nimble, by being quick to change, whether there's a health challenge or a disaster there, we should be able to sort of quickly move because that is what changes life. Next, I think we are done. Thanks a lot.